So what are the biggest problems facing the healthcare industry right now, and how do they impact employee safety?
Well, Peter, the healthcare industry is currently grappling with a significant staffing shortage, which that has a direct impact on employee safety. Some statistics for you: approximately 1 in 5 healthcare workers have left the profession since the pandemic began, and only about 90% of nurses are considering leaving the profession in the near future. This shortage, coupled with an increasing workload and schedules, leads to unprecedented levels of burnout among healthcare professionals. So what can burnout do? Burnout can result in medical errors, healthcare-acquired infections. It compromises patient and employee safety. Furthermore, workplace violence is a major concern in healthcare, with healthcare being one of the most dangerous industries to work in. And I didn't know this until I really dove in deep into the research for my book. But healthcare is the second most dangerous profession that we have. And staffing shortages can contribute to increased vulnerability and increased or decreased safety for employees in healthcare.
How can safety and security leaders improve safety outcomes?
That's the big burning question, Peter. While staffing shortages may sometimes be beyond the control of safety and security leaders, there's still measures that we can take to address systemic issues in healthcare to improve those safety outcomes. One of those crucial measures is to encourage employee feedback and develop a culture of near-miss reporting. So a near miss, which is also referred to as a good catch in healthcare, these are events that could have caused serious injury or death, but were intercepted before harm or incidents occurred. So these near misses serve as like a heads up to us to break down to the breakdowns in organizational systems. It's most important for healthcare employees, who are the eyes and ears of the organization, to have an accessible tool or system to share these observations and report the system failures that they see that may lead to harm. So giving these employees a platform to report the near misses and incidents and unsafe conditions, an organization can identify potential safety hazards, and they can identify the root cause, which is usually a system failure. What we like to say, it's usually system failures and not a human failure. And then the leadership and the system can take the proactive measures to prevent harm. So this creates that culture of prevention. And that's something that we really, really focus on in healthcare, is a culture of safety and a culture of prevention.
Now, how does this culture of near-miss reporting impact healthcare employees directly?
Well, one, when employees feel encouraged and supported to report incidents and near misses, it creates that sense of engagement in the care environment and an empowerment to direct the care they're providing. So when healthcare professionals are actively involved, then they feel a greater sense of purpose and fulfillment in their work. All of us entered the profession to help, heal, and serve. And so when we're given tools to be able to do that better, provide better care to our patients, to ourselves, then we operate, as our best selves. The second thing is, this in turn leads to increased employee satisfaction. We hear a lot about that in all industries, higher levels of engagement, and improved retention rates. So, for example, according to the advisory board, it cuts employee turnover in healthcare in half, from 21.5% to 8.8%.
Wow.
So yes, that's incredible. So, if given this information and tools, when it's presented to healthcare leaders, we see the light bulb go off, just like I saw, with you, and it makes it's a no-brainer to implement these programs. So, as we know, employee engagement is strongly correlated to employee safety, and it correlates to a safer work environment.